Bismillah ar-Rahman ar-Rahim. Dear students, I'm going to talk to you about the second lecture, which has the title of Indications, Types and Steps for Crown Construction. First of all, if we are going to talk about the indications for crown construction, we are going to see that if we have a big damage in the tooth, or the tooth has a big carious lesion and is going to be restored with a big amalgam or heavy filling, and both of them, the remaining tooth structure and the filling material, they are both weak materials, or they are weak, and we must do a crown to cover them and make them stronger. The second indication is the restoration of the aesthetic and the mastication, or the function of speech. The speech and aesthetic, they are mainly when we have a case of anterior damage of the teeth. As you see in the picture number 2, you have a big fracture of the anterior tooth. The speech and the aesthetic of the patient will be affected. So when we do a crown for this fractured tooth, we will restore the aesthetic and the function. But while in the first picture, the masticatory function will be affected because it is posterior region, and when we do a crown, we will restore the masticatory function. Number 3, here we are going to restore the aesthetic of the patient. We are going to improve the appearance of the patient, like the presence of discoloration or malposed teeth, or any problem which affect the appearance. We can do covering of the teeth by crowns, which they are good in appearance, and it will lead to improvement of the aesthetic. Number 4, we are going to maintain the periodontal health. If we have a condition like in the left pictures, here we have an attrition of the teeth, and these teeth, they are affected from their appearance, because they will be shorter and shorter by the time, and there will be a great pressure on the teeth, which will lead to a problem of the periodontal ligament. So if we do crowning for these teeth, we will improve aesthetic, we will stop wear of the teeth, and we will protect the periodontal tissues. The 5 indication for a crown, if we have a bridge, because the crown, if you see the upper right picture, the crown will be part of a bridge, and we call it retainer, and this retainer has the function of fixation of the bridge on the natural teeth. The types of crowns, if we classify the types of crowns according to the amount of covering of the natural tooth, we will have a complete crown, or we call it full crown. Here we have many types of full crowns, either full metal crown, the middle and the left pictures. We are going to see that we have full covering of the coronal portion by either gold or other metallic materials to form a full metal crown. On the right picture, we are going to see a non-metallic full metal, non-metallic ceramic full crown. We call it jacket crown. The jacket crown, it is a full crown made from material, non-metallic material. The other type of crown is the partial crown in comparison with the full crown, because this crown, the partial crown, it will not cover the whole coronal portion. In the left picture you are going to see that we prepare a tooth leaving the labial surface or the buccal surface untouched. Here we are going to prepare all the surfaces leaving the labial or the buccal surface for aesthetic purposes. It will have a natural appearance. We are not going to cover the labial surface with artificial material. The third type of crowns is the post crown. Here in this case we have no crown, no coronal portion. The tooth has completely fractured, leaving only the root of the tooth, and it is difficult to retain a crown on it. So we must do another type of crown by taking use from the root canal space, and we are going to extend part of the crown in the canal to retain it in place. This type of crown, we call it post crown. It is used for non-vital teeth, and we must do a root canal filling for this tooth to keep it healthy in the future. Now, if we go to the steps of crown construction, we are going to see that the first step, when the patient came to you, you must diagnose the case and see if it is indicated for doing a crown or not. The first step, we are going to do clinical examination after we take the history from the patient, complete history about his problem, and then we are going to go to the clinical examination by examining the periodontal health. The patient must have a good oral hygiene, his teeth must be clean, his periodontal tissue must be healthy, there is no any plaque, calculus, or any gingivitis in his tissue, and this case must be, or the patient has a good oral hygiene to be indicated for crown and bridge. If it is not, we can refer the patient to the periodontal department to clean his tooth or his teeth to be ready for crown construction. Again, we go down in the mouth of the patient, and visually we are going to examine the occlusion. It is very important. If there is any crowding of the teeth or spacing between the teeth, if there is any tooth rotated, and we are going to have a complete examination of the remaining teeth in order to decide or analyze the treatment in the future. Again, after we finish from the clinical examination, we must send the patient to X-ray to have a radiographic examination. From this radiographs, we are going to see if there is any condition, abnormal condition in the bone, or any abnormal conditions in the root, or we are going to look about the roots of the abutments which they are going to be used to support the bridge or crown in the future. The size of the root, the length of the root, the number of the multi-rooted teeth, or if there is any unerupted teeth, if there is any bone loss, all these things will be revealed the condition of the surrounding tissues around the abutment teeth. It will be examined radiographically. Now, the second step, which is very important step, and it will done by the dentist clinically, is the preparation of the tooth. The abutment tooth will be cut in such a way to make it suitable to receive or to seat a crown on it. Here in this left picture, you are going to see two teeth are prepared. One of them is completely natural tooth, and the other one is fractured, and it is rebuilt with composite material, and then we prepare both the tooth structure and the filling, and this tooth preparation make it ready to receive crown. The third step, after we finish our preparation, we are going to take a final impression by using an elastic impression material. In general speaking, the elastomeric impression materials, they are the materials of choice to be used in the final impression taking. After we take the impression, we return back to the prepared tooth. We are not going to leave it exposed in the oral cavity. We are going to cover it with a temporary crown. This crown in the picture, you see it made from copper. It is a very thin crown. Is going to protect the prepared tooth until the final crown is finished. After we take the impression, we pour it with a gypsum material to produce the working cast or working model, and then we are going to build a wax pattern. We call it waxing. That means we are going to make crowns from wax material, and then we shift to the other step, which is the investing, by embedding the wax pattern of the crown or bridge in the investment system by covering the whole wax pattern with investment material to be ready to be casted in the next step. The casting here, we are going to put the investment system in a furnace, or we are going to exert heat on this investment to remove the wax. Just like the step of flasking and wax elimination, it is the same principle. When we invest the wax, we are going to do a flasking, just like a flasking, and we are going to put the investment in the furnace, and then we are going to make the wax melt, and we remove the wax. The space left after wax elimination will be filled with a molten metal, and then after we finish our casting, the casting is the pouring of the melting metal in the investment. After the molten metal is set hard, we are going to remove the investment material, and we can take the crown or bridge from it, and we are going to check it on the model to see if it is okay or not. Before we put it on the model, put it in the patient mouth, which is the cementation of the crown or bridge. Now, If we compare between the designing or construction of crowns and bridges and the removable partial denture, the difference here is the presence of disadvantages in the construction of crown. The first one is the height generation due to the severe or the big amount of cutting from the tooth structure. This will lead to an effect on the health of the pulp in the future. So we must be careful in applying cooling system from the cutting turbine or instrument during the whole time of cutting or preparation of the abutment tooth. Again, there will be a periodontal problems if we are not going to do a perfect crown and bridge designing. There will be a problem of food impaction or secondary caries formation, in addition to the other periodontal problems like the pressure on the gingiva and other problems of the periodontal tissues. Over preparation, if we cut much or more from the tooth structure, the pulp will be irritated, and in the future, due to this heavy preparation, the pulp will be dead, and this will lead to what? To a problem of pulp infection, and it requires an endodontic treatment. Now, the objectives of tooth preparation. Why we cut from the tooth structure? The first of all is to eliminate the undercuts which they are present on the surfaces of the natural tooth. The undercut, it is formed by the presence of height of convexity in the surface of the tooth, and the area below this height of convexity or the height of contour, it will be laid in an undercut area. So when we are going to do a preparation, we must cut the tooth in such a way, making the surfaces of the teeth without any presence of undercut, to make it possible to see the crown on it. In the right lower picture, you see the tool of surveying or analyzing the presence of undercut. We call it the surveyor. It is a tool made to analyze or to planning the presence of undercut on the teeth of the case of the patient. Now, the second objective of cutting from the tooth structure during preparation is to create a space between the opposing teeth. In this picture, you are going to see that the teeth, the natural teeth, they are in occlusion. And when we do preparation, we must leave space between the natural opposing teeth. If we have no space, it will be impossible to put a crown without disturbing the occlusion of the patient mouth, and it will be a difficulty in occluding or closing the teeth in the proper way, and this will lead to a problem in the joint of the mandible. Here in this picture, you can see that the cutting of the occlusal surface and the other surfaces of the tooth, it will make it possible to make a thick crown, and in this thick crown we returning or put the crown in the normal dimensions of the natural tooth. If we are not going to do a good preparation, or we are not going to remove the required amount of the tooth preparation, either the crown will be thin or it will be bulky. So if it is thin, it will be a weak, and if it is bulky, there will be a problem of occlusion with the other opposing teeth. Our lecture is ended, and I thank you for your listening, dear students.